Need to wake up to what we're doing. It is now estimated, 350,000 new chemicals in our environment in the last 70 years. The vast majority have never been tested for safety in human beings. Electromagnetic spectrum that we live in never existed until recently. The difference between 4G and 5G isn't one. It's not 1G. It's a factor of 1,000 increased exposure that we have to EMFs that we didn't have before. New ideas are not embraced in medicine very readily. Technology, yep. New drugs, yep. Because there's a huge financial impetus to embrace them.
I got a very high backlash back in the day.
Drummed out of the medical profession. Our immune system loses containment, then we're off to the races.
How does it affect the child as a whole?
Mold toxin can get into literally all body fluids. Know that mold toxins cross the placental barriers, and it gets into breast milk.
It's a pleasure to have you here, Dr. Nathan. I would like to start with a very important question that's going to set up our entire conversation for this podcast as a whole, which is, when did you start noticing that our world, our environment is getting exponentially intoxicated through many different things, and how that led you specifically to mold and Lyme's disease, for example?
I think that perception has been very slow growing over time. As an optimist, I always wanted to believe that the world I live in is a relatively safe place, and that my children and grandchildren will have a planet to inherit that is fundamentally sound. But as I continue to practice medicine in this world, it became really obvious that we are in the throes of multiple epidemics of all kinds of illnesses that either weren't present 50, 60 years ago or are now truly epidemic proportions. I mean, cancer is an obvious one. Autism is an obvious one. I mean, 20 years ago, it was rare to have an autistic child. Now, depending on the state, as many as 1 in 15 or 20 children are autistic. I mean, this is not a minor issue. This is huge. Mold toxicity, it has existed since biblical times, but was relatively rare until recently. Chronic fatigue, fibromyalgia were unheard of until recently. Lyme disease was virtually never described in the medical literature until recently. So, and we're talking millions of Americans have these things. These are not rare conditions.
Mm-hmm.
So, to be honest, it doesn't take a rocket scientist to look at this and go, what's going on in our world? How is it that these conditions have exploded in terms of what we're seeing and what we have to work with? And again, you can look very, very simply at the world that we inhabit. It is now estimated, 350,000 new chemicals in our environment in the last 70 years. The vast majority have never been tested for safety in human beings. The electromagnetic spectrum that we live in never existed until recently. Mm-hmm. And the various companies that sell those devices, this is wonderful. We had 5G now, 10G is rolling out. And what a lot of consumers don't understand is that the difference between 4G and 5G isn't one. It's not 1G. It's a factor of 1,000 increased exposure that we have to EMFs that we didn't have before. So for me, forgive me, it's a no-brainer. We have done this to our world, and we need to wake up to what we're doing very quickly, because we're making our world so toxic that it's going to be very, very hard to live in it.
I totally agree. When I was young, so I'm 20 now, and you mentioned that autism and many other diseases were not common, When I was young, when I grew up until high school, I have not seen a single person that had autism. Now it's 1 in 20, I think. I think
Yes.
in the UK, it's 1 on 19 people. I'm pretty sure it's about on that range. And it is very scary, to be honest. It's very scary. And I think most doctors, many doctors and other health professionals are intertwining words that does not have the same meaning, which is normality and commonality. Because something that's becoming common does not mean that is normal. And that's what's happening with autism, Parkinson's, and many other diseases that we're being exposed through different toxins. And it's just unheard of. There are not many physicians just like you and many others that talk about mold toxicity, that talk about Lyme disease and many other diseases that are being very prevalent in our world today. And why do you think there's a lot of backlash between something that is just a no-brainer, as you said? It's a no-brainer. However, why does it suffer so much backlash, especially in the United States?
The history of science and the history of medicine is new ideas are not embraced in medicine very readily. New technology, yep. New drugs, yep. Because there's a huge financial impetus to embrace them. But in medicine, there's this concept of we don't want to embrace anything prematurely because we don't want to be wrong about it or hurt somebody. So you really need to prove this to me beyond any shadow of any doubt before I will embrace a new piece of information, even when this information that we're looking at is really scary if we're looking at it from a realistic, scientific, medical perspective. I mean, as a medical doctor, I've been practicing for over 50 years, and I've watched these changes occur in our health and our healthcare system. And it's very slow for some of our colleagues to embrace that. Often the common statement people will make is, well, there are some experts who say that Lyme disease chronic Lyme disease doesn't exist. There's a whole group, the International Infectious Disease Society says there's no such thing as chronic Lyme disease. They call it post-Lyme syndrome, which is a fancy way of linguistically denying what is right in front of people's faces.
Mhm.
The CDC recognizes that there are 675,000 new cases of Lyme every year. So, okay, clearly we have an epidemic on our hands far greater than anything that we ever saw with AIDS. But that hasn't reached medical education yet. So there are many young doctors who are being taught by infectious disease specialists there's no such thing as chronic Lyme disease. And we're leaving literally millions of people undiagnosed and untreated because we haven't proved it yet to their satisfaction. I mean, I personally have helped 4 or 5 thousand people with Lyme disease get well. So either all of us are delusional, or I've taken so many people from a compromised state of health where they're almost bedridden to living functional, healthy lives. I don't think I'm delusional. I think other people just aren't willing to look at our experience as being valid.
Mhm. I totally agree. In your story, talking about medicine, how medicine has a really rough time to accept new things, new ideas, not new technology, not new drugs, because that's a whole different story. But it really reminded me a story of Ignaz Semmelweis. I think that's how you pronounce it. Which he was a medical doctor in Florence, I believe in the 1400s, 1800s. I don't remember exactly the time. And back in the day, many doctors were valued as someone who had a lot of blood in their shirts, in their scrubs, etc. However, that would be extremely harmful for them to treat patients, for example, women that were having birth, etc. And many of them were having infections that would later kill the mom, kill the baby, etc. And he just proposed a very simple thing: just wash your hands. and that was completely got a very high backlash back in the day.
Oh,
Um,
he was drummed out of the medical profession for
yes,
suggesting that people wash their hands.
yes.
I
So
mean,
it's
I mean, doctors back then, surgeons would have their hands in an infected abdomen dealing with pus, and then they would walk into the next room and deal with folks with no idea of how they would be spreading germs in those days. But again, you're absolutely right. He was drummed out of the medical profession and died in disgrace
yeah.
because he had the temerity to suggest we ought to wash our hands.
Talking back about mold toxicity, you said it was very, very common in the biblical times, very, very from a long time ago. And what did change since we always had back in the day, but now we have a much higher incidence of mold toxicity, even though it receives a lot of backlash by many people and it's not diagnosed as such.
A lot of things changed. One of the big things that changed was when the energy crisis occurred in 1979, we began to build buildings differently. Instead of having air flowing through buildings, now we tightened it up. We put in tons of insulation. There was no movement of air in a building, so that the natural movement of fungi or mold through a building, in and out, never occurred. And if there was water damage to that building, then mold would grow in that building unopposed by anything else. I mean, the particular issue is often in the category of sheetrock. And the inside of sheetrock is paper. And the paper is made by compressed sawdust, which is made from the bark of trees, which, as you might imagine, would have quite a lot of mold on the bark of a tree.
Mhm.
And so when you make that into paper, it's kind of like instant mashed potatoes. You just add water. Molds can go dormant for thousands of years. And then if you add water to it, then they will come alive and grow. I mean,
Mhm.
they've taken mold spores from the tombs of pharaohs um, and found that you can grow it. So you're now adding water to a moldy area which is dormant, and now it starts growing inside a building with no natural, um, I'm not going to call them enemies, but no natural counterpoint to keeping them contained in any way, shape, or form. And then we're exposed to them.
Mhm.
There's additional thoughts. There's a well-known medical doctor, Dietrich Klinghardt, who specializes in Lyme disease, who believes that the increase in EMFs, particularly 5G, has disturbed the mold to the point that essentially, if you give the language, it's pissing off the mold to the point that it is becoming more toxic than ever before in trying to defend itself against what we are doing to its environment. So there is the thought that the mold has become more toxic. It's now more prevalent in our environment. I mean, studies from the government show that 47% of all homes have visible or smellable mold in them. We're not talking about something that happens rarely. We're talking about something to which all of us are exposed on a regular basis. So those are some of the pieces of the puzzle as to why is mold toxicity becoming more rampant. A third component of that is that our immune systems, because of all the toxic exposures that we have become weaker.
Mhm.
So if you have a robust immune system, you could live in a moldy environment for many years and basically blow it off. It would not affect you. The
Mhm.
same, by the way, is true of Lyme disease. You could be bitten by a tick, and if your immune system is robust, your immune system will fend off the infection and basically hold it at bay in the same way that your immune system has faced many viruses and other microbes over the years, and they're not all out of your body. It's not like we get every single microbe out when we treat with antibiotics or we heal. um, they go dormant or latent,
Mhm.
held in check by our immune system. When our immune system loses containment, then we're off to the races. And you can lose containment by an infectious illness, COVID being a big one.
Hmm.
COVID weakened our immune systems profoundly, both from COVID itself and from the vaccination. And childbirth, surgery, and emotional upset. We live in very, very, very stressful times. And
Hmm.
so this has an impact on our immune systems that I don't think is fully appreciated by the medical profession. So I think that is addressing why we're seeing it now, and we haven't in the past.
I totally agree. We were talking about one thing that I noticed in the difference between United States and Brazil, that's the country I'm from, is that how the houses are built. In Brazil, I see that mold toxicity is not that common because of how the buildings were built. And I find it extremely interesting how the United States hasn't been setting anything that can avoid that in a way, especially in very humid places. For example, I live in Florida, very, very humid places that that you can be exposed for many diseases easily. And I think it's very, very complicated. Another thing that I've noticed in the United States, but also in Brazil, obviously, is that most women are having menstruation cycles earlier than usual. So about in the 1920s, usually they would have menstruation, their first menstruation in when they were 15, when they were 14. And now we're having people that are having menstruation cycles when they are 9. So how does mold play an estrogenic effect in women and men, and how does that affect our health?
Well, there's a couple of factors here. Number one, probably even more relevant than mold, is the presence of what we call xenoestrogens in our environment. I mean, xenoestrogens are molecules, many of which are plastics or in the plastic family, that mimic the structure of estrogen to the point that the body thinks they're estrogens and reacts to it. And the plastic explosion in our environment has made xenoestrogens a major component of what all young women are being exposed to now that they've never been exposed to before. In the mold category, there's a particular mold toxin called zearalenone, which has an estrogenic effect, so that it will mess with someone's normal hormone um, balance very profoundly if you get exposed to that. And it's one of the more common toxic molds that people do get exposed to.
Yeah, one thing that I've seen, so I would like to share a story with you that I've noticed, which I haven't thought in a long time, and I just thought recently that I've seen a couple of women walking close to a few friends of mine that we were just walking, and I noticed that I could smell their perfume from like such a big distance that I was like, wait, what? Why are they putting so much of those things? And also, not just that, obviously, but just how much this is disrupting their endocrine system as a whole. It's a very big impact. I really see that. And so talking about mold again, I've heard a few times that mold toxicity can be transferred from the mom to the child, either through breastfeeding or either from the placenta. How does it affect the child as a whole? So being early contaminated by those mycotoxins.
Well, it's true. It's not like a rumor. There are
Mhm.
medical documentation that mold toxin can get into literally all body fluids. So we do know that mold toxins cross the placental barrier so that the fetus, the growing fetus, is exposed to it during development, and it gets into breast milk. So the fetus is being exposed to it if the mother does have mold toxicity. That's true. I
Mhm.
don't think that's even argued by anybody as to whether it's true or not. Um, and again, if the medical profession as a whole isn't looking at mold toxicity, then we are putting these new infants at risk. So, example, we maybe there is a connection between the epidemic growth of autism in this country, because we do know that mold toxin causes autism-like effects, and that autistic children, many of whom do have mold toxicity and get much better when we treat it.
Hmm.
So these are not necessarily unconnected events. So when infants have mold toxicity, they can have the same symptoms that anybody has that gets exposed
Hmm.
to it, which is global and systemic. I mean, mold toxicity um, can affect virtually every organ system in the body and often does. So it can cause, in a general way, things like fatigue or malaise, but in a more specific way, just going through the organ systems, it can cause headaches, joint pain, muscle pain, shortness of breath, um, asthma-like symptoms, cardiac events, palpitations, um, cognitive impairment of every type. We know that in Dale Bredesen's work, most of the people he's looking at with Alzheimer's have mold toxicity as a part of what's going on for them and get better when we treat it. So, I mean, this can be a scary conversation for your listeners. But what I really want to emphasize is everything we're talking about here is treatable. This is not oh my God, you're all screwed. This is in the category of, if you open your mind and heart to the possibility that something's going on, we can do something about it. So I come to the table not with pessimism, but with hope, but with, we have learned a lot about how to treat this.
Yeah. I think also going back to the conversation of the two words that doesn't intertwine as much, which is normality and commonality. Since something has become common, I think that many people forget that things happen for a reason. There's a reason for something to be happening. Sometimes we just normalize those things and completely forget that there's a solution. There's a possible solution for those things, which could be treating mold, which could be treating many other things. Also, another problem that we have, obviously, it's diet, etc. But if you're having weird allergies, weird symptoms, that's most likely mold or other disease that's not often talked about, just like Lyme disease, etc. One of the main misconceptions I see about mold is that they don't know that mold can affect your body in many different ways. Could be either skin reactions, could either be just brain fog, could be fatigue, could be just pain in general. Many of those things. And I've I was I follow the works of a psychiatrist called Barbara Werner in Brazil, and she applies the same thing, treating the gut microbiome and also for mold toxicity and many other things. Which she uses similar tests to the GI map and OAT, which I believe you're very which you know that a lot. So if my listeners don't know, O is organic acids test and GI map is the gastrointestinal map. Those are two tests that are often done. Um, and it emphasizes your microbiome health, and also if you're having any mold toxicity and things like that, and also your metabolites for the TCA cycle, etc. And she uses that, but she alongside also followed the works from Georgia Ede and Chris Palmer from Harvard, which they're very big proponents on the ketogenic diet for treating those symptoms that could be from either mold, but also which we normally diagnose as schizophrenia, Parkinson's, etc. So, does mold feed from carbohydrates? Is there something linked to that? Does mold feed from any dairy products? Which, if you avoid, that could get you could get better from that.
Absolutely. Mold is accompanied almost always by candida, which is another fungi. They're in the same family. Um, their favorite food is carbohydrates. Their ultra favorite foods are sugar and fruit. So if you do have mold or you do have candida, you don't really want to feed it by eating a lot of those things. You want to limit your carbs. You basically want to be on a high protein, low carb type diet. and it makes a big difference in treatment. Um, so the ketogenic diet is a favorite of Dale Bredesen's when he's treating Alzheimer's disease. The autoimmune paleo type diet, which is somewhat similar, is, from my perspective, one of the most anti-inflammatory diets around. So, that what we're dealing with mold toxicity is not the mold per se, but the inflammation that the mold is triggering. It's really all about inflammation. And so these are anti-inflammatory diets, and so they would have a beneficial effect on any organism. In terms of your friend in Brazil, I didn't mention, but I really should,
Mhm.
that mold toxicity causes or worsens virtually every psychiatric condition known.
Mhm.
So it will cause, in people who haven't had it, anxiety with panic, depersonalization, derealization, depression of every time, hopelessness, OCD behaviors,
Mhm.
um, all of that mold toxicity will trigger. So often there are a handful of integrative psychiatrists in our country who have become aware of this information, and they've begun to look for mold and Lyme and certain biochemical imbalances
Mhm.
as an underlying component of a variety of people who've been diagnosed psychiatrically and getting terrific results. So
Mhm.
it's important that people look for the root cause of what's making people anxious. Giving someone a benzodiazepine is a band-aid. Yes, you can feel better with it. You
Mhm.
can also get addicted to it and have a horrible time withdrawing from it once you get on it.
Mhm.
So it has its uses, but if you're not looking for the cause, that doesn't strike me as good medicine in any way, shape, manner, or form.
Yes. And do you think most psychiatric diseases in specific could be misdiagnosed because in the literature, I wouldn't say in the literature, obviously, because it is there, but I would say in medical school, in conventional um, ways of teaching, conventional education in medical school does not teach that. Do you think many of these diseases are misdiagnosed in a way?
I think it's a convenient label that gets thrown on
Mhm.
something that enables someone to throw a medicine at someone, and then you can maybe see more people, or in our crazy medical world, which is based on productivity and not healing, then you can whip people in and out of your office and they'll feel maybe a little bit better, but you've never
Mhm.
dealt with the problem. And
Yeah.
in the psychiatric field, to me, psychiatry is living in the dark ages and has been
Mhm.
for decades,
Yeah.
which is, not only are they not looking at the biochemical or infectious underpinnings of the psychiatric condition, but they don't dig into a person's root causes. Like, what is triggering a person to react in this way? And
Mhm.
if you don't get to that root cause, you're never going to deal with it. So even when I was a medical student, this goes back well
Mhm.
over 50 years, I was very frustrated by the what looked to me like the lack of curiosity on the part of the psychiatric profession in
Mhm.
delving into each patient, like, why are you manifesting this in this way? What is
Yeah.
unique about you? What should we be learning? What should you be learning about your upbringing, your environment, your exposures, your way of looking at the world that would allow you to live in this world in a more comfortable way? And we're not doing it.
Yeah. One, just like you said, for many psychiatric diseases are just terms that does not target the root cause. Same thing with SIBO, gut dysbiosis. Same thing that conventional doctors do. Okay, SIBO, small intestinal bacterial overgrowth. What bacteria is being overgrown? You do not have specifics. So how are you going to treat that problem? Same thing with gut dysbiosis. What bacteria is upregulated? Which ones are downregulated?
Well, again, and I hate to trash the pharmaceutical profession for this, but once you come up with a drug that will treat something, that will get pushed in
Mhm.
medical education. So rifaximin is viewed as the answer to treating SIBO.
Mhm.
Now, in my world, one of the most common causes of SIBO is overgrowth of mold and candida in the gut. And you can treat with rifaximin till the cows come home. You can use a host of probiotics and prebiotics and anything you want to do. But if you don't get the mold and candida out of there, that person's not going to get well. So it's partly not knowing what it is you need to be treating to get that person's biome back into balance again.
Yes, one of the things I feel it is, correct if I'm wrong, but that mold makes your body weaker in a way which allows overgrowth from other pathogenic bacteria, just like H. pylori, etc. Is that correct?
Yes, that is correct. Mold weakens the immune system profoundly. And it's one of the difficulties with it. Yes, we now know we can do urine tests and we can tell someone you've got these mold toxins in you. I know how to get them out. I can give you very specific binders to pull those out of your body. If you have colonized, if the mold is growing in you, in your sinus and gut areas, I can treat you with antifungals and get that out of your body. But what is missed is that the mold toxicity has messed with the immune system to the point that we've lost containment. So other latent, dormant infections like Epstein-Barr and HHV6 and you name it come to the fore because, again, of a weakened immune system. So what we're really doing is lowering um, the mold candida count in the body, reducing the toxic load so that the immune system bounces back and recovers. That's what we're really doing when we're treating mold. So that once the immune system recovers, it will get everything else under containment and that person can be healthy again. So I think that that's missed often when people are looking at it as mold toxicity, as a kind of like a standalone way of looking at it.
Hmm. Yeah, I totally agree. And I was gonna say something. Um, oh yeah, I remember in your book, I was talking with a friend of mine that had already read your book, and he said that one of the quotes that he was highlighted and he would like for me to ask you is that you highlighted that 10 million people in the US is being contaminated by mold. Don't you think it is more than that?
Maybe I nobody is looking at this from a public health perspective at this point.
Hmm.
That is a crude estimate that a lot of people have guessed at that over many years.
Hmm.
I think it's accurate
Yeah.
as far as it goes. Could it be more than that? Yes, it certainly could.
Hmm.
Uh, from my perspective, it's simply an epidemic, which is the real problem is that there are literally millions of Americans who have it, who have no idea that they have it. The doctors they're seeing have no idea that it exists, and they're going untreated
Hmm.
with you name the condition. It could be SIBO, it could be IBS in the gut area, it could be heart palpitations, it could be anxiety or depression,
Hmm.
it could be headaches or joint pain or muscle pain. It's not going diagnosed because nobody is thinking of the diagnosis because it's not in their education. I don't know that there's a medical school in the country that's teaching anyone about mold toxicity as a major cause of chronic illness.
Hmm. Yeah, not even from what I heard, doctor being a DO, doctor osteopathic medicine. I don't even think they do that too. They usually follow the same curriculum as the MD does. And talking about the inactive forms um, of disease that we were talking about mold, does that also apply to Lyme's disease and its co-infections? How did that also a very even better question. How did those co-infections from Lyme arose?
Well, there's a whole bunch of questions embedded in
Yeah, in
that
one. So
question.
let me just reinstate it. So I would like to start with Lyme and how these co-infections started. and also talk about the how certain remissed, um, I would say inactive forms of bacteria could be active from that, and how those co co-infections could play a role on that, and how did that arose?
Okay. Let me start with a tick bite.
Mm-hmm.
Most of the co-infections come from the bite of a tick. Not all. You can get it from the bite of certain flies, fleas, mosquitoes. It's not just the tick that's at risk here, although that gets the worst publicity for it.
Mm-hmm.
When a tick lands on someone's body, um, the first thing that it does is it sucks blood out of that body into its stomach. It's called a blood meal. And as the tick remains on the body, after a while, it injects that contents of its stomach, which had the person's blood in it, back into that person. So Dr. Joe Burrascano, who's one of the best known Lyme docs in the country, used to call this nature's dirty needle, in which when the tick bites you, it injects into you after a while whatever is in its stomach contents. And that includes not just the Borrelia, Lyme bacteria,
Mm-hmm.
but it includes Bartonella, the parasite Babesia, the bacteria Ehrlichiosis, a number of viruses, sometimes chlamydia species, um, mycoplasma. I mean, there's a whole lot of nasty microbial material that gets injected. So the co-infections, the word means this is what is being injected into a person from that particular tick. In
Mm-hmm.
different parts of the country, studies have shown that the contents of the tick, when studied, are different. So in some areas of the country, there'd be about a 40% chance of a tick biting you and you getting Lyme disease. That same tick would have a 40% chance of giving you Bartonella,
Mm-hmm.
10% chance of giving you Babesia, and 8% chance of giving you Ehrlichia, and so on. So, I mean, that's what the co-infections are. They're additional microbes injected into the body with the Lyme, all of which weaken the immune system. So the underlying issue here, like mold, is that one of the defenses that the Lyme bacteria have, and Bartonella, and Babesia, and all the things we're talking about, is that they intentionally weaken your immune system so that you can't fight them.
Mm-hmm.
It's really simple. It's a life form. It wants to live. It wants to live inside of you because you're a wonderful host
Mm-hmm.
for it. You provide wonderful nutrition. Temperature is perfect. It's dark, it's moist, it's lovely in there, wherever it happens to be, wherever it migrates to. Why would it leave? So the this so I think that's answering
Mm-hmm.
part of your question, but I wanted to tie it to the immune weakening process because that is a huge piece of all of this.
Mm-hmm. So obviously, everyone's treatment is different in a way. Everyone's treatment is based on their own specific problems that they have, etc., which could be SIBO, whatever, even mold toxicity. But what would you normally treat Lyme disease? So those are parasites or bacteria that are on your body, and how do you target them? Because I have no clue. I was never taught that.
No, once again, there are millions of people in this country with it, and you really ought to be taught about it in medical school. Um, Now, the whole field of Lyme and co-infection medicine is huge, and it isn't simple. It is not like, oh, it's a bacterial infection. You're going to take an antibiotic for a week and you're going to be fine. These are very different organisms. Um, it partly has to do with dividing time of a microbe. That might not sound interesting to anybody, but um, Lyme bacteria and Bartonella grow very slowly. And the way antibiotics work is it kills the microbe when it is dividing, when it is multiplying.
Hmm.
So if you take a bacteria like strep or a staph infection, which everyone's familiar with,
Hmm.
those grow so rapidly that if you have an antibiotic on board, you are killing it every time it divides, which is quickly. You can get well from those infections quite quickly. But if you
Hmm.
take Lyme disease, in which basically it turns over and divides every 3 weeks, Bartonella every 2 weeks, you're dealing with a common misconception, for example, is you go to an emergency room, you've been bitten by a tick, even if the ER doc is wise enough or educated enough to realize I've got to treat it, standard treatment is for 7 to 10 days. Well, if the dividing time is 3 weeks, there's a pretty good chance that you're not even going to catch one division in those 7 days. And so you may not be helping that person at all.
Hmm.
So logic would be, and people in the Lyme field know this, you need to treat someone with a tick bite for at least 6 weeks so that you're catching at least two division cycles and you really have a much better chance of knocking it out. I mean, that's why untold numbers of people have gone to an emergency room, gotten a week worth of doxycycline, and then come down with full-blown Lyme disease shortly thereafter. It's because they're
Hmm.
not being treated adequately because doctors need to study and understand these microbes so that they can deal with them appropriately. And sorry, all medical schools should be having courses taught by people who actually have studied this field because this is different than other infections. This is not like other infections that you would be treating with IV antibiotics in a hospital setting for 3 days, and then you go on orals, and then you go home and you're fine. This is a different ballgame.
I totally agree on that. And what do you what do you believe could be done to avoid any tick bites? Is there anything that you could avoid with ticks to not contain the bacteria itself? Or is just good luck, don't be bit?
Well, vigilance. So if you're hiking, you should check your body to be sure there aren't any ticks crawling on you afterwards. If you catch it before it bites you, no problem. Um, So it's super important to get on it early. Um, there's all kinds of salves and lotions and sprays you can put on your body, some of which are fairly toxic, that might prevent being bitten by a tick. Honestly, I'm not particularly impressed that any of them work very well. I think it's awareness and vigilance of
Mhm.
when you come back from a hike, check your body. You know, when I lived in Missouri, we had tons of tick bites there. Um, and the real issue were my dogs had frontline on them. So the ticks didn't want to bite my dogs. They came in on my dogs and then crawled around looking for us, my
Hmm.
wife and I and my kids. So um, dogs will bring it into your environment, and you got to know that.
Hmm.
Uh, sorry, if you get caught up in paranoia, that's not helpful.
Yeah.
But being careful, watchful, and vigilant is something that human beings need to do. Being blasé and negligent is not going to help them.
I totally agree. I want to go back a little bit to mold because, for example, I study now at USF, University of South Florida here in Tampa, which is a very moist place. And the apartments here are usually moldy. And most people, they do not know what can be done to avoid any of those problems because they just live in that apartment. They have just that apartment as a choice. So, what can you do if your house is contaminated by mold? What can you do to your home to prevent more damage towards it?
Well, first, if your house has water intrusion, you have about 24 to 48 hours to get that mopped up, cleaned up, and dried. You can't sit around waiting for the landlord to decide they want to do something about it.
Hmm.
By the time that happens, you're already off to the races in the wrong direction. You have a
Hmm.
little window. Now, forgive me, but Florida is only number two as the moldiest state in the country. Texas has
Hmm.
that distinction, but for the same reasons, which is both states are hit regularly by hurricanes that come in at 80 to 100 miles an hour with horizontal rains. Houses are not built to take that. And so houses leak, water gets in, and then mold starts growing. One thing you can do preventatively is if you keep the humidity of a particular home at 40%, maybe 50, but no more,
Hmm.
use dehumidifiers and measuring the humidity, mold doesn't grow well in that environment. So it's if you minimize the humidity inside a building, you're going to be in much, much better shape for preventing the growth of mold. As you
Hmm.
mentioned in Brazil, where there's more openness, if you
Hmm.
can keep the windows open, if you can get air flowing through on a more regular basis and keep the humidity down, that's those are things that people can do that really make a huge difference.
I agree. I totally agree. And what about those candles? I've heard some people talking about candles that avoid mold in a way. How does that work?
No, they're claimed to kill mold in the air. I've
Hmm.
used them for years and they don't work very well at all.
They don't work
That
very well. Okay.
that is not a way to get rid of mold. Uh,
Hmm.
it's it helps people think that they're doing something about it,
Hmm.
but it simply
Yeah.
does not work at all.
And what about vinegar and baking soda? I've seen some people trying to get rid of mold, putting baking soda or either vinegar towards it. Does that help? Because from what I heard, on the other hand, it makes the mold even stronger. So what's the thing about that?
Well, we need to distinguish mold from mycotoxins, which the mold
Hmm.
makes. It's the mycotoxins that are making us sick that is being
Hmm.
made by the mold.
Yeah.
If you can clean some surfaces with just soap and water on a regular basis. Just cleaning it will remove the mycotoxin, but it won't remove the mold. If there is mold in some environment, you have to know where it is. You have to
Hmm.
find it and get rid of it, literally, surgically. So mold may be
Hmm.
inside of walls or underneath tiles in
Hmm.
a bathroom or behind a splashboard in the kitchen. Sometimes you can see it. Often you can't.
Hmm.
And but the mold is so small, mold spores are so
Hmm.
tiny that they can go through a tiny crack in the wall, which is for them like a superhighway. So
Hmm.
they can come from behind the wall, enter your environment, and make you sick. So the key is to find it. And that's not easy. Not all mold remediation experts really are trained to know how to do that properly. In many states, you can be licensed to evaluate a house for mold with 10 hours of training. And I can
Hmm.
assure you that is not sufficient to know what you're doing. So there's a very huge disparity in terms of the remediation experts. Some really know what they're doing, and
Hmm.
some don't literally at all.
Hmm. I totally understand. And do you think is there anything missing that we should emphasize on this podcast? I think. Do you think there's anything to be highlighted for future medical doctors, future health professionals regarding mold, Lyme toxicity, etc.?
I think what I would want to emphasize was that if someone presents with a complicated condition with multiple systemic symptoms, traditionally, when doctors hear that, this is psychological until proven otherwise. In this case, not. So if you are presented with something that is complicated, think mold, think Lyme. They're
Mm-hmm.
very common, and if you don't think about it, you're not going to help that person because you're going to basically miss the diagnosis. And then we have iatrogenic harm, where we're telling them it's not possible to have all of those symptoms. This has got to be in
Mm-hmm.
your head. I'm going to send you to a psychiatrist.
Yes.
That isn't going to help anybody. So, number one, think mold, think Lyme. If you don't learn about it in medical school, find a place to read about it, study it.
Mm-hmm.
If you want um, in some of my books, there's a lot of information that can at least get you started. Um, my new my book Toxic, which has been a bestseller, we just recently did a second edition, adding 6 chapters and a whole lot of new information to it. That would be a good starting point.
Hmm.
Um, in the Lyme world, the books by Dan Kinderlehrer and by Rich Horowitz are excellent. Rich Horowitz's book, which is Why Am I Not Getting Better, and Dan's book, which is an overview of Lyme disease, are excellent overviews filled with scientific information, references if you need them, that would help you all to understand. These are very real. You really need to study it. Um, when I went to medical school, and I think everyone got the same lecture, um,
Hmm.
we were told day one by the dean of students at the first lecture that 50% of what we're teaching you right now will be wrong in 20 years.
Hmm.
Unfortunately, we don't know which 50%. So you're going to have to learn it and regurgitate it and learn it.
Hmm.
But it's interesting that people take that information differently. When I heard it, it meant, oh, I guess I'm going to have to study for the rest of my life to stay current. Some of my colleagues heard, I hope that whatever I learn will last me for the rest of my life because I don't want to stay learning. So the key is you have to stay curious. You have to keep learning because information is accumulating at a rate that's almost unfathomable at this
Hmm.
particular point. Rather than be overwhelmed by it, embrace it. Whatever it is that you learn will be useful. Are you going to learn everything perfectly? Not a chance. But you can learn enough that you can really do a service for your patients if you embrace curiosity and the learning process, um, and understanding that what you're learning in medical school is not sufficient to get you through life, even from when you started. Sorry, it's just
Hmm.
not. And I hope that that message can be received in the spirit that I mean it. It's not a knock on medical education, but it's an understanding that you need to dig deeper
Hmm.
always, deeper than your professors may dig. That's on you.
Yeah.
So that's my message.
Yeah. Thank you so much, Dr. Nathan. And just a last question. Where can we find your book, your new book, Toxic?
Okay, it will be out. The new one will be out September 16th, but you can pre-order it.
Hmm.
Um, and I have a whole bunch of other books if you're interested.
Hmm.
One written a number of years ago is called Healing is Possible, and it's a very good review of functional medicine.
Hmm.
I think it was ahead of its time. Um, but those two would be a very good start for anybody to begin the process of learning about what it is you don't know that you
Hmm.
really need to know in order to help people optimally.
Hmm. I agree. Thank you so much for talking to you, Dr. Nathan. It was a pleasure.
Okay, pleasure here as well.